Hi guys, Dr. Waller here. Today I'm going to do a video about extremities. So all my past videos that I've done to date have been about adjusting the spine for various problems that people have, but I've never really talked about adjusting extremities like feet, knees, shoulders, jaws, what have you. But a lot of people don't know that chiropractors can actually adjust just about any articulation in the body. Typically, I don't start with adjusting extremities if I don't have to, because my experience, and I've been doing this close to 25 years now, that most extremity problems actually aren't a problem with the joint itself. Because most joints are actually pretty simple. There's, for the most part, just hinges. And as long as they're being stabilized right and the muscles that move them are not weak or in spasm, joints typically don't cause a lot of problems. But there is a time and place for adjusting extremities. So this patient's going to tell you her story, but she originally came in and she had bad foot pain, and I started off, I checked her feet, and then didn't find too much that really kind of drew my attention, but I found a lot of pressure in her back, where normally I find foot pain from. So I started working on that, and she did get some response. She got quite a bit better in the feet, but it never quite got well. And then decided, well, let's send you for an MRI to see if there's anything going on there that maybe explains why this isn't resolving. And it led us to something that we had to adjust in the foot, which was the talar navicular joint, which we'll show you if we adjust that today. But I do want her to tell you her side of the story while I go ahead and check her spine.
Sure. I'd been chiropractic here for years, and it never occurred to me. When I started having foot pain, it never occurred to me to come and see my chiropractor about it, but I ignored it for a long time. My feet started really bothering me, and I just kept ignoring it because I have flat feet, and it was just normal for my feet to kind of bother me, but it just got progressively worse. I probably started hurting like maybe in February, and I just kept ignoring it, and by April it was so bad it was really getting difficult to walk. So I went to a podiatrist, and he x-rayed, said there was nothing wrong with my feet, and really all he could do was cortisone shots in my foot and give me stretches. I knew I didn't want to do the cortisone shots in my foot, so I came to see Dr. Waller just for my regular adjustment, and I think I hobbled in here, and he noticed immediately that something was wrong, and so that's kind of how we started that. But before I even came in, I remember one day I stood up, and the pain was so bad in my foot I literally crumbled to the floor, and I would have a couple of days in there where I couldn't walk at all. I had to scooch on my rear around the house just to get around. I couldn't walk. So what he has been able to accomplish has really been remarkable. I never would have thought ever. The x-rays, I guess the regular x-rays didn't really show what he was able to find out. I'll let you tell the rest of that story. But
yeah, the MRI that we got basically showed that there was some degeneration going on that didn't show up on the x-ray at a certain joint. And then when I got in there and really started palpating and examining the joint, it was stuck, and she was really, really tender on that. And it wasn't until we got the mobility back in that joint that she actually got out of pain. There's a story I always like to tell when it comes to extremities. I had a patient one time who fell off a ladder and broke both of her feet and ankles. And clinically, they already healed. So, after 8 weeks, bones are typically healed, but she still couldn't walk at all. And it wasn't because the bones were bad or a problem. It was the joints of the foot. There's as many bones in the foot as there is your spine. There's 26 bones, and they all have joints. And we're on our feet all the time, so those joints can get damaged. And if they don't flex and move when you're moving and stepping on your foot, then that will cause pain. And just like all other extremities, you can damage any extremity or any joint in the body. It's possible, and sometimes that does require them to be adjusted. So in my practice personally, I always will check the joints, but I like to start by clearing the spinal issues that could be affecting it, just to make sure that's not it. Because if you manipulate joints that don't need it, there's a potential for traumatizing them, and we don't want to do that. So I don't adjust things that absolutely don't need it. So I'll work with the spine first, give that a reasonable amount of time to see if it's helping. If not, then I'll definitely pursue adjusting the extremity. So today on her, all I really found was a little pressure in her lower back. She's got a bad fifth lumbar that will cause spasms. Most of the plantar fasciitis that I see, heel pain or just bottom of the foot pain, I never have to do anything to the foot. It resolves completely from fixing the low back in most cases, probably 90% of the time. But in 10%, you just have to work on the feet a little bit. One place that adjusting feet is really big too, a lot of people don't realize, is that in seniors who have balance issues. There's a little kind of test we can kind of do for seniors. If you have them close their eyes, they'll start wobbling, because Our proprioception and our balance is driven by two things: our eyes and then the joints of our body telling us where we are in space. And as people get older and accumulate damage in their feet, those feet joints just don't send the brain the signals about where it's at, so they're relying completely on their eyes. And when we close our eyes and take that out of there, what happens is they'll get wobbly, and if you don't catch them, they'll fall over. So by working on the feet of people like that, you'll be able to bounce back in most cases. So let's go ahead and get her adjusted up. We'll do her low back first, and then we'll get over here and adjust the feet. And I'll actually check the foot over here. It's just a little easier for me to examine it. Some joints of the foot are easily examined in the seated position, but for her particular one, it's better to do it over here. Okay. All right, let's come on over here. Lay on your left side facing me. Bottom leg straight. So in the foot, and we're going to do both, or check both of her feet. In this region right here, you got the junction between what's called the talus bone and some cuneiform bones and the navicular bone. And her particular issue is between the talus and the navicular. So when I check it, I just check to see if it's moving or if it feels restricted, and she gets restricted right there. Okay, and that's tender on her. And we check the other foot, and I'm just flexing it to see how it moves. This foot doesn't feel quite as bad, but she does get a little restriction right there. So these are the joints that we're going to adjust on her feet. Okay. Nice. One more time. There it was. Good. All right. And that's as simple as that particular adjustment is. So, like I said, if there's a shoulder, we have ways of doing that. We can adjust jaws. We can actually adjust sinuses, knees. Pretty much any extremity articular joint that we need to do. So I hope that was informative. It's made a world of difference for her in her case, because she's one of the 10%ers. But if you have any questions, please reach out to me. Thanks.